Welcome to the first review of two parts on the treatment of psychological disorders. In this video, I'll review some of the early approaches to treating disorders, and then we'll look at some of the approaches today. In the second of this two-part series, we'll dig deeper into the current approaches to treating psychological disorders. Let's take a moment to look at the history of mental health treatment. When we think about some of the stigma that still exists today and is very unfortunately affecting many people in their choice to seek treatment, we can think about how the past has affected how we think about psychological disorders and seeking treatment now. It's important for us to understand our history because it helps us to understand why we are where we are today. We know that there are many people who suffer from mental health issues who don't seek treatment. Now, there are many different reasons why, which we'll be exploring later in the chapter. But if we take a look at the frequency of mental illness, you'll note from your textbook that about 19% of adults and 13% of adolescents experience mental illness in a given year. You'll also notice that about 1/3 to 1/2 of adolescents with mental disorders receive treatment. This, of course, can have some very significant implications that we'll be exploring and discussing later on. So how have psychological disorders been viewed in the past? And more specifically, how does this then relate to how people were treated in the past? So in the past, people thought that mental illness was thought to be caused by supernatural forces. And these supernatural forces could be things like demonic possession or witchcraft. And so people who had any sort of symptoms of mental illness would be often subjected to cruelty and inhumane treatment. Some of the treatments that were used to address these supernatural forces included exorcisms, and this involved having incantations and prayers that were said over the individual's body by a priest or religious figure. So, of course, no one wants to think about being the possibility that they're possessed. And so you could imagine why people might not want to admit that they're having symptoms. People might not want to share that their family members are having symptoms. So think about how has this then continued today? Although we don't, of course, see exorcisms and we don't have this very obvious view that they had then, or this very very clear view that people had that disorders were caused by demonic possession, we still see some remnants of the idea that something is wrong, that something is bad if someone has a psychological disorder in some families and in some communities. Fortunately, what we're seeing is a lot of changes in terms of how we're viewing mental illness, and that people who do have symptoms they're more likely to seek treatment because they're not seeing or feeling that stigma that they once had. But there are still many people, especially older generations, who may feel the stigma still, and then who don't get treatment. And then we can think about the ramifications of that. There's something called Trefening, and Trefening was an approach that was used to reduce the symptoms of a mental health disorder. And this is where a hole was made in the skull, and the purpose was to release spirits from the body, and this often led to death. And then there was also execution and imprisonment, where people who were mentally ill were burnt at the stake after being accused of witchcraft. Some of you may have heard of trial by dunking, where a witch would be thrown into the water, and if she drowned, she was not a witch, but of course then she wouldn't survive. But if she didn't drown, she was a witch, which then meant that her fate was pretty much set, that she was probably going to be burned at the stake. So when you were different, having symptoms of a disorder, especially if you were having experiences like hallucinations and delusions, you could think about how serious the implications of that would be. Today, we don't have imprisonment for having mental health issues, but we see that there's a disproportionate number of people who are in the prison system who do have serious mental health issues, and we'll be looking at that here shortly. If we move forward in time just a little bit, we go into the 18th century. And in the 18th century, if people exhibited unusual behavior, they began to be institutionalized. And so if you were having, for example, hallucinations or delusions, you probably were going to be institutionalized and you would be there for the rest of your life. And these institutions were deplorable. They had terrible conditions, and you can see a graphic representation in your textbook on 16.4. And this is an artist's rendering of what these asylums were like. And people who were in these asylums were treated terribly, and these were not clean conditions, and of course you could imagine, and also overcrowded, the effects of this on a person who has a mental illness. Also, the focus of asylums was on ostracizing people from society, not in treating people. And people would be chained to beds, they wouldn't have much contact with others, and they would be, in many instances, in what we might think of today as an isolated confinement. If we continue in the 18th century, we have a very important advocate for people who had mental illness, and that's Philippe Pannell. And he was a French physician, and he believed that people who had mental illness should be treated humanely. They should be talked to. And patients benefited from this, and many were able to be released from the hospital. And you can see here an image by Tony Robert Fleury, where there's a depiction of Philippe Pannell ordering the removal of chains from patients at an asylum in Paris. If we move forward in time, we move into the 19th century, and we see a very important person whose name was Dorothea Dix, and she became an advocate for people who had mental illness, in particular people who were poor and who had severe mental illness. And what she did is she investigated the state of care for the mentally ill and poor, and what she discovered was that people who were poor and mentally ill were abused, and that the system was not regulated. And so she was instrumental in creating the first American mental asylum. And she did this by relentlessly lobbying state legislators and Congress to set up and fund these institutions. The conditions of American asylums in the 19th century, these conditions were terrible. The asylums offered very little treatment, they were very unclean, and when people were institutionalized, they were generally institutionalized for decades. The treatments would involve things like submersion into cold baths for long periods of time, electroshock treatment, which is now called electroconvulsive shock therapy. And what this did, and again it is still used, is it involves a brief application of an electric stimulus to produce a generalized seizure. And today it is used to help people who have severe depression that has not been able to be effectively treated through other means. So when someone has very serious symptoms of major depression, this has been found to be effective. But this was a pretty common approach that was done. And there are some very negative side effects that people experience. And we'll be looking at that here in just a little bit. But if this would not, there were not other types of therapies that would be used as a first resort. You'd find that when people had the symptoms of mental illness, that they would experience these very negative types of therapies that could be very damaging to a person's psyche. And these types of conditions and treatments were common until well into the 20th century. We see a significant shift in 1954 where antipsychotic medications were developed and introduced. And these medications were successful in treating the symptoms of psychosis. And psychosis at this time was a common diagnosis, and a person who had this would have hallucinations and delusions, which would indicate a loss of contact with reality. We'll be looking more in depth at what hallucinations and delusions are and some examples. In 1975, we see what's called the Mental Retardation Facilities and Community Mental Health Centers Construction Act. And this particular act provided federal support and funding for community mental health centers. So this then began the process of what we call de-institutionalization. And this was where we had large asylums that began to close, and this allowed people to stay in their communities and to be treated locally. And so it moved people in the direction of being able to be treated much more humanely and with much more dignity. So while with deinstitutionalization, we see more humane treatment and people being treated with more dignity, we still have some significant problems today. We have many people who have mental illness who are unable to get treatment. We also see that mental illness among the homeless population is still common today. And of the homeless individuals in U.S. shelters, about 1/4 are thought to have a severe mental illness. This was reported in 2011 from the Housing and Urban Development. And correctional institutions also report having a high number of individuals who are living with mental illness. And when we look at the percentage of people with mental illness, or the number, I should say, of people with mental illness living in prisons versus living in state institutions, the number of people with mental illness living in prisons is much higher than it is the number of people who are in state institutions. So there's clearly a lot that we still need to do. So what is mental health treatment like today? Well, we've talked about how asylums are no longer in place, and they've been replaced with psychiatric hospitals and local community hospitals that have focused on short-term care. And the emphasis is on short-term stays. And what this means is that people will on average stay for less than 2 weeks. Some of this has to do with the high costs of psychiatric hospitalization, and also because insurance limits the amount of time that a person is able to stay in a psychiatric hospital. Typically, people are usually only hospitalized if they are an imminent threat to themselves or others, and most people who have mental illness are not hospitalized, but they can still seek psychological treatment. But I think it's important to note, again, that there are many people with mental illness who do not seek treatment, and there are many different reasons why that we'll touch on later. An important concept to note is what's called involuntary treatment, and this is therapy that is not the individual's choice. And so, for example, a person may, who perhaps is, maybe they are convicted of a crime, and part of the condition of them being on probation, or maybe when they are released on parole, the condition is having to go to weekly counseling sessions. We might also think about people who maybe they have they have been convicted of drug possession, and when this happens, sometimes, often what will happen is of course, it depends on where the person lives and the judge. For many people, they may not have to spend time in jail. Instead, they may be on probation and have to go to mandatory drug treatment sessions, in addition to some other consequences, like having to visit a probation officer and do community service. But that involuntary treatment would involve going to drug treatment sessions, or meeting with someone perhaps, and it would not be institutionalization. It would not be where you're forced to stay somewhere. It would instead very likely be that you're weekly going to some sort of sessions or meetings in order to help you to overcome your addiction. And then there's voluntary treatment, and this is where the person chooses on their own volition to attend therapy to obtain a relief from symptoms, and this is what is the most common. And there are many different places that people can get treatment. People can get treatment through private practitioners or community practitioners. So in our own community, we have people who are licensed professional counselors, they are PhD psychologists, or they may be licensed clinical social workers, and each of these individuals could have their own private practice, and they may work for a group or an organization that is for profit or not for profit. There are also community mental health centers. Some mental health centers provide counseling on a sliding scale. For others, it may be, for example, that you have to pay. You may pay $10 a session, you may pay $5 a session based upon your income. In some instances, you may not have to pay anything at all, depending upon the center. At ETSU, they have a community counseling clinic in their education program, or more specifically, their counseling program. And people who go to that program or to those services can receive counseling free of charge. And the counseling is done by graduate students who are under the supervision of a professor. And then there are school psychologists, school social workers, there's group therapy, and treatment providers, as I mentioned, can be clinical social workers, they can be licensed professional counselors, marriage and family therapists, psychologists, and psychiatrists. Now, psychiatrists are people who have gone to medical school and they have specialized in psychiatry. They've done an extensive residency in this area, and they're able to prescribe medication. There are very few states in the U.S. where psychologists are able to prescribe medication. That's something that is the focus and ability typically of the psychiatrist, who would work in concert or in partnership with that individual's psychologist, social worker, or therapist to help that person to reach their individual goals. In this video, you learned about some of the approaches to treatment in the past, and you had an opportunity to consider how these early approaches and early views on disorders may contribute to some of the beliefs that people have today about psychological disorders. While a significant amount of progress has clearly been made, we know that there are many people with psychological disorders who don't seek treatment or who don't have access to treatment because of lack of insurance, the cost, or even living in a rural area with limited access to care. While there are many community health centers that provide care on a sliding scale, there are still opportunities for progress to be made in this area so that more people who need treatment can receive the care that they need. In this video, we also looked at the path toward progress in the treatment of disorders, and you learned about advocates, including Philippe Pannell and Dorothea Dix. You also learned about some of the major approaches to treatment today. In the next video in this two-part series, you'll learn about specific approaches to the treatment of psychological disorders.